Hi, this is Tory Cenaj, and I'm the founder and publisher of Partners in Digital Health, publishers of Blockchain in Healthcare Today and Telehealth in Medicine Today. And you are listening to Pharmacy Podcast.
Pharmacy Podcast Network. Todd, Eury, founder of the Pharmacy Podcast. Hey, I'm excited. You know, obviously we're focused on pharmacy. Obviously, specialty is just blowing up. I just got back from the NASP, the National Association of Specialty Pharmacies annual event in Washington, D.C. Sheila Arquette and her team do an absolutely amazing job. I say kudos to you and Teresa, Sheila. Shout out to the organization. We published the NASP podcast dedicated to that. Very excited about conference season coming up. We're going to the NCPA, the National Community Pharmacists Association. That's going to be in Boston. That's next week. You're listening to this podcast. Today is Friday, October 5th. However, I want to share something with the listener base, something that we just don't hear enough about. There are a couple pharmacists that have mentioned it, a couple blogs out there, a couple papers, but we really haven't dug into what the heck is this blockchain stuff and what does it mean for healthcare? What does it mean for outcomes? What does it mean for payment structures? And what's really interesting is I've made a contact that has really been a light for me with regards to the subject, who has really spearheaded the whole entire concept under digital health, partnerships in digital health to really make sense of blockchain in healthcare today and telehealth. The founder of Telehealth and Medicine Today, Tory, welcome to the Pharmacy Podcast Network.
Thanks so much, Todd. I'm honored. Thanks for having me.
You're very welcome. I have so much appreciated you. You had blind trust in this crazy, voice that called you and tweeted you and emailed you and tried to get your attention. And you are a veteran publisher, and you know this world of publishing. I've done it all by grassroots, and I've really done it the hard way. You are someone that really understands what content is important at the time that it's important, and then how to gather steam and partners around that. So let's first tell the listeners, the Pharmacy Podcast Network, a little bit about yourself, your publications, and then I can't wait to share with our listeners what Converge to Accelerate is all about.
Oh, thanks so very much. So it's really pretty simple. I have my eye on the horizon line, and innovation is what I suppose fuels me and my curiosities. And so I launched first Telehealth in Medicine Today, which was our first peer review publication. Next, we launched Blockchain in Healthcare Today, and that was earlier this year. And what I found was a significant void and gap in the marketplace, because when I ask people, especially in healthcare, my own physicians, do you know anything about blockchain? They kind of look at me funny, and because, they want to look like they know, they would say, oh yeah, Bitcoin. That's gone down significantly, hasn't it? I've been advised to stay away from that. And I'm like, oh, I kind of shake my head. It's blockchain technology. It's not Bitcoin, and it's blockchain technology in healthcare. So, and then of course there's a whole lot of hoopla and fake news and all sorts of things going on with ICOs, and that hit the waves, and that's just not what it is for us here in healthcare in the least. And so my thought was, okay, I think it's time to launch a peer-reviewed publication called Blockchain in Healthcare Today, to give, lend some credibility, establish credibility, bring credibility, and validation, more importantly, to the marketplace for blockchain technology in healthcare. So those are our two journals, and in tandem with those two titles, we also have, as you just mentioned, our Converge to Accelerate conference, scheduled later this month, and along with that, an innovation ignition competition, and that's for certainly innovators and startups with new products in the area in both telehealth and the blockchain sector. So these are the activities. They are new, they are fledgling. There's an awful lot occurring in these two areas, certainly in the innovation technology sector. And I think a lot of promise for it as well. And so, yeah, I mean, we've pushed forward. We launched our first issue in March of this year. We have, for a new journal, mind you, well over 10,000 downloads. We've experienced our first citation, which is nearly unheard of for a newly launched journal, peer-reviewed journal. And
you're international. You're international,
yes,
which
yes,
is crazy.
Yes. We've also, we're read now in over 65 countries worldwide. And this has happened in a matter of months. So clearly there is quite a zeitgeist out there. We have put our finger on it. And, you know, as you said, you build a marvelous team. But beyond that team, I think, and this is what we've heard, for example, and our board members have heard speaking at meetings and conferences elsewhere, you know, attendees, participants are literally standing up and saying, oh my God, thank you for launching the journal. It's been so informative, and I'm beginning to understand things now, and thank you. And so this is our purpose in the industry, for the industry, and getting back to that credibility and validation in the marketplace. No, it's not Bitcoin, and no, it is not fake news.
You have a pharmacy insider as your managing editor, Mr. John Russo, who's a PharmD. I'm excited. I hope to meet him because we're actually attending, the Pharmacy Podcast Network will be attending and helping out with some of the panels that are going to be there, which we're so thrilled and honored to do so. But tell me about John a little bit.
I actually worked for John in a former role, and he headed up one of the premier medical education companies in the industry here stateside. And we did a lot of work together in publications and publication planning and medical education. And he has written, I don't know, 300 or 400 plus manuscripts, I think, to date now. So very, very well versed with journals and the requirements and the formatting and so on and so forth. Because what we're finding is, you know, it being a rather new marketplace, there is so much innovation in it. And the folks on the innovation and startup side, not so much the research and academia side, but on the innovation side, they're not familiar with writing a scholarly manuscript to submit to a peer-reviewed journal. So, you know, we get questions like, you know, what's an abstract? How do I write it? How do I format this? And, you know, can you explain this to me further? So that is actually one of the sessions at the conference. I mean, it's so important that we take the time to educate people on how to actually write a scholarly manuscript for submission to a journal, not just our journal, any journal. And there's so much innovation in the marketplace out there, and so many pilots and outcomes to report and present and share to build. Again, we get back to credibility in the marketplace. It really is important for us to teach and share and educate. And we have partnered with a medical education company in the industry. One of the leaders, it's Cadent Medical Education. It's part of the Syneos Healthcare group. And so they will be presenting on, again, how to write a manuscript. You know, how do we do this? How do we get heard and share, which is the most important thing we can do right now.
So I'm all excited and talking to you because I know you and I know what you've done and what you've built. Our listeners don't really, we're asking them to catch up as you're listening. And what I want to let everyone know is, you know, this is a facet, this is a piece of the evolution of healthcare and some of the infrastructure behind the scenes that is going to transform how we communicate from a payment perspective, from information being shared in electronic health records. So Tory, just for the listeners who don't understand blockchain, and I'm going to put my hand up in the back of the classroom very slowly and embarrassingly to say that I'm one of those. Let's take a pause and just give us an elevator speech of what the heck is blockchain and how does it tie into healthcare, and even furthermore, how does it tie into pharmacy?
Okay, so I can be in the back of that same room with you and put my hand up too. And that's usually where I am because I'm usually learning, and that's what I like to do most. And so when we look at blockchain, there's so much, just so much going on in blockchain, and so much rapid development, and so many pilots now underway. You know, both in on the commercial side, in government, for example, on the academic side. So, you know, I'm playing catch up. We're all playing catch up because it is that new. It has been referenced as the fourth industrial revolution, you know, out there with artificial intelligence and you know, the Internet of Things. And so it's just another technology that we are looking at in this transformation and modernization. So, you know, what types of things can and does it impact in healthcare, for example? Certainly security, certainly identity, contracts, most definitely, payments. We're looking at drug supply chain management,
Right.
Cost efficiency. I mean, bringing it full circle to the journal's editorial mission, what I would like to show ultimately, and what some people are slowly showing now with some data, is the cost efficiencies that it can bring to A, health systems, and B, to patients. And I honestly am most concerned with the patient efficiency and cost savings part of it, and I'll tell you why. And I don't think I've shared this with very many people, if any at all, and now I'm sharing it with your audience of 70,000 times. So it's a good thing I can't see any of them because I would absolutely die. But I am not covered at present. I have no health insurance. And that has happened to me thrice in my life, twice in between jobs, couldn't afford COBRA. And now again, this is the third time that I have opted to go without health insurance. And I have two chronic conditions, mind you. So it's not funny. I mean, I'm hoping they're not life-threatening, but this is my choice, number one. I know and I understand that. But when you have a startup, and I'm sure some of your pharmacists on the front lines meeting and servicing patients on a daily basis. I'm sure they see this on a daily basis. It's tough. It really is tough. It's a startup, and I have to ask myself some really hard questions, and I really have to make some hard sacrifices. I want to move this initiative forward, and so how can I do that? Bootstrapping it. And so, yeah, healthcare gets redlined, but I am not an N of one. I know I am an N of millions in this country for an inordinate number of reasons. I mean, in my case, it's the startup. Perhaps in my neighbor's case, it's because, they lost a job, or they've got 5 kids, or, someone needs surgery now, or, you know what I mean? Everyone's situation is different. And healthcare is really something that we take a really, really hard look at, and the cost of healthcare. And so, getting back to blockchain technology, how can it impact the cost efficiency within the health system? And can it change some of these legacies? And how, at the end of the day, can me as a patient, afford to get back into the system? And how long is it going to take to trickle down to me? So this is where I'm coming from, and what my very personal interest areas are in, or with the impact that this technology can have to the industry.
Thank you so much for sharing that and being so transparent. That's special. And there are so many healthcare professionals in that exact boat. And I think they run 82 miles an hour to just service their patients and do their job and work. And the intelligence and the information that you're providing to our healthcare system is significant. I think you are very much like me, where we just are hard workers, we're innovators, and we never take a look in the mirror to really give ourselves a check of what we've accomplished, because this is the second Converge to Accelerate, or is this the first?
It's the first, it's our second conference. Last time, or last year rather, it was Technologies and Tactics Transforming Long-Term Care on the Telehealth side, because we have the Telehealth Journal. But this year now, with the Blockchain Journal, we've rebranded it Converge to Accelerate, and we've expanded it to include blockchain. And so, but it not only encompasses telehealth and blockchain, but these other innovative technologies modernizing healthcare. I mentioned AI, machine learning, for example. We've got some panels in there on the digitization of clinical trials. We're looking at EHRs, for example, and interoperability. And so there's just so much in that agenda that you can find from a novice perspective on through to and for a savant. So we've really covered the gamut in so far as providing richness in the value of the education at the conference. There are 50 sessions.
Richness is underrated in what you're saying, because listeners, let me tell you what's going on. So if you go to Converge to Accelerate 2018 .schedule.com, and I'm going to put this in the show notes, so anybody driving, anybody working out right now, don't worry about it. It's going to be in the show notes. But I want you guys to realize there are some major rock stars who are going to be at this. I'm going to start off just letting you know, insiders to the pharmacy world. Kevin Clausen, he has been somebody I've watched for years. He's innovative in the way he thinks. He's an associate professor, College of Pharmacy and Health Sciences at Lipscomb University. He just loved the way this guy's brain.
He's fabulous.
He is. Dr. Migliori is going to be there. He's been on the Pharmacy podcast. He is really a visionary as a chief medical officer for the United Health Group. And so excited. I hope I have an opportunity and a time to say hi to him again. Your team, your speaker team is also made up with, my Lord, it's like over 50 people that I keep reading. I keep scrolling. And I keep reading.
It's 100 people, Todd. Don't shortchange me now. So listen. It's and they are all luminaries. Truly, they're all pioneers. They're all innovators in the industry. Market savants. They look. These are the people that are creating the marketplace. Period. End of story. And so, yeah, we've got Optum, yeah, we've got Humana, certainly United Health, and Richard is speaking on the telehealth health policy debate. And there is also a blockchain health policy debate. And so, we're asking hard questions, why blockchain at all? Is it necessary at all? So we're really drilling down and asking some really, really hard questions. And of course, cost is one of them. For the telehealth policy debate, for example, the resolve is there is greater financial value in telehealth for consumers than for providers. And so it'll just be an amazing, amazing experience. I don't think very often you see true debates, true health policy debates conducted at conferences with an affirmative team and a panel on the negative side as well. So it really will be interesting, and the audience gets to vote.
That's amazing. That's incredible. I want the listeners to also know you can follow along the conference. You'll be able to follow along through at Pharmacy Podcast on Twitter, but the hashtag is CONV2X. That's CONV2X, hashtag CONV2X, October 24th, New York City. There's so much energy going into this. There's so much attention on this. There's so much chatter. That in itself is just a win for what you've put together, Tory, and the champion that you are in really pushing this, and the changes that we're expecting to come with the innovators to really get out of the status quo, because the pace of healthcare today. And you're a testimony to this with the complexities and the costs and the inability to be covered is preposterous. And I think that this conference is going to help to create basis for change based on the innovation within the structures that everything sets upon, because everything in healthcare will eventually set upon technology. It is not even a question. 20 years from now, they'll look back at us all and they'll be laughing, saying, what do you mean they did it this way? What do you mean? There's just predictive modeling now, and you pick a disease state and it tells you exactly how to manage it and what, biometrics to put in and pharmacogenomics to make sure that you can absorb the drug and efficacy and all this other stuff. So this is exciting to be a part of this. I want to thank you, by the way, for just extending an invitation to the Pharmacy Podcast, getting us involved, but then you're sincere because of how many people that touch pharmacy that are part of this event shows the sincerity of collaboration that, unlike other healthcare conferences, you haven't left pharmacy out.
No, absolutely not. And I think you're a pivotal part of the equation, in all honesty. But our platform is one of egalitarianism and very collegiate. And a word that's used with blockchain very often is democratization. So our arms are open to everyone. For example, we've got a special rate for students. and PhD candidates. And so everyone is impacted by this. Everyone is touched. Everyone should come to the table and play a role. Everyone's voice should be heard. So, we're also going beyond the borders of the United States, presenting a world view. And some of the systems outside the US, for example, Switzerland is coming, the Netherlands is coming, India, the UAE is being represented, England is being represented. So there are other pilots and initiatives underway that is transforming healthcare, and they are already realizing and can show cost savings using this technology. And that's what we want to show here in the US. And so it's very, very important to cross borders and reach out, because it's everyone's, the convergence, if you will, and this is how I came up with the title, is what accelerates us. And without that understanding, we kind of go nowhere fast. And I would like to fuel this, most certainly, technologies to accelerate building a new framework for the future of patient care and modernizing a new health system. And you can't do that without your eyes wide open. You need to be exposed to so much more than what you know and what you see or what you read on a daily basis. And so hence, we have these 100 people coming and speaking and sharing, and the networking and understanding and dialogue, the lessons learned at these events will likely change, certainly strategic plans, but understanding in our fee for service to value-based change now, that data sharing and delivering of care at the right place, at the right time, at the right cost is critical, is what's critical for business survival now heading forward.
So if you're listening and you have an opportunity on October 24th, Columbia University, this is going to be a major event. We're going to look back in the state of history and really understand that there was an inception to really accelerating the technology of what is blockchain, what is artificial intelligence, how does telehealth fit in, what is this all cultivation and collaboration truly mean, not buzzwords, but actual actionable, usable technology platforms. Tory, I'm excited. I can't wait to finally meet you in person. We're going to get some pictures, obviously. If you are around, there's going to be a link in the show notes to sign up for this event. Once again, Columbia University, October 24th. It's coming up very fast. Hashtag CONV2X, Con V2X, the Converge to Accelerate 2018 conference. Tory, thank you so much at such a fast-paced notice. It was like Tory and I picked up like 2 weeks ago. The next thing you know, I'm part of a panel. My head's spinning on my shoulders. I'm like, hey, let's do a podcast on this so we can talk to our listeners about it. And then here we are. So thank you so much for how fast you move.
Thank you so much. This is a startup. We can turn on dimes and don't need to ask permission, which is marvelous. But it's the event will be well worth looking at your schedule and clearing that schedule for an opportunity like this one. I know it's only a couple of weeks out. It's the 24th and today's the 5th of October, but we have plenty of time. And so if your listeners are interested, again, we welcome you with open arms. You should be part of the dialogue and voice your opinion, network, and find opportunities for you to grow and impact your daily life and jobs and patients.
Absolutely. Blockchain healthcare blockchain healthcaretoday.com. I want everyone to go out and look at that. Once again, that's blockchain healthcaretoday.com. That will also be in the show notes. Tory, I will be seeing you on the 24th of October as you're swarmed with a bunch of other people, and I'll definitely be there early in the morning. Can't wait to meet John and your team, but I thank you for putting this together and your dedication to this and for being on the Pharmacy Podcast.
Thank you so much. And Todd, it's not done without a team. It takes a village, and I say that all the time. And the team is absolutely fabulous. From the editor-in-chief, John Halamka, to each and every single board member and the contributions they make and the peer reviewers. It is absolutely, positively a team effort. That is the only way to do it. And we see it not just with the journal, but here now with the conference. And you are a testament to that as well, being partner and collaborator. So thank you very much.
Thank you, Tory. We are going to do some follow-up. We're going to have Dr. Clausen come back on the show and really dig into blockchain and pharmacy. So I'm so excited about that inroad and what you're doing for our entire industry of what is this crazy healthcare system that we're in. I will see you on the 24th, and I thank you for being on the show.
Thanks so much, Todd.